But I wanted to speak today and this week about the importance of treating mental health and the importance of the role that law enforcement plays in the way we treat mental health in this country. For too long, law enforcement and emergency room personnel have been, in effect, the de facto mental health delivery system for the country. The National Institute of Health says that 1 in 5 Americans have a mental health or behavioral health issue, and that 1 in 9 adult Americans has a behavioral health issue that impacts how they live every single day. 2 Congresses ago, in the 115th Congress, Senator Stabenow and I worked to pass legislation, the Excellence in Mental Health Act. What that did was create 8 state demonstration projects that would last for 2 years each to see what would happen if we treated mental health like all other health, something that everybody knows I believe we should have been doing, something that in 8 states we are doing. And Mr. President, the good news was that 24 states, a number that exceeded every discussion that anybody had about how many states would step forward and say, we'd like to be the states that try to do this first. 24 states applied. I was certainly proud that Missouri was one of the 8 states chosen to be in the demonstration project. We're about halfway through the 2-year project, and in our state and in the 7 other states, people have access to mental health services that they didn't have before. Most Missourians are within a relatively short drive of a facility that will treat their mental health problem like it was any other health problem. As we begin to do that, I think we're going to see the kind of impact on law enforcement and the kind of help that law enforcement needs as well. Just a couple of years ago, I rode with both the crisis intervention teams in Kansas City and in my hometown in Springfield. In Springfield, what I saw there was officers dealing with a 24/7 link up to the Borough Mental Health Clinic, the local and regional mental health provider. 16 officers at that time had, in effect, Mr. President, iPads that linked them up to a mental health professional. Didn't take too long, and I think this would be indicative of what most law enforcement officials see almost every day. It didn't take too long before we came on someone huddled in the alcove of a building that was vacant, who clearly had a behavioral health problem. Wasn't at that point a drug problem or an alcohol problem. They were where they were because they had a mental health problem. The officer was able to Skype back immediately with a mental health professional. What I was really most interested in, even with a well-trained officer who knew exactly what they were doing and how to do it, even with that officer there, as that officer linked the person up with someone, in effect, a telemedicine link up with the mental health professional, you could tell that that person was more comfortable talking to the iPad and communicating that way than he was with the officer that was right there with him. And it wasn't because the officer was in any way intimidating or unprofessional, but it was just because of what it was, a link up with someone at another site, but someone who clearly was well prepared to deal with those kinds of issues. So we're going to see that benefited, the kinds of things that the mental health community can do to provide more resources to the law enforcement community under Excellence in Mental Health is providing a service, and I think producing real results. And I'd also say, as I conclude my remarks on this topic, what we hope to see is a significant number of people, and remember, I said NIH said 1 out of 5 adult Americans has a behavioral health issue. What happens when you deal with that behavioral health issue in terms of how you deal with all the other health issues that individual or that community would be dealing with. What happens if somebody is feeling better about themselves, taking their medicine, eating better, sleeping better, showing up for the doctor's appointment, showing up for the dialysis appointment, doing what they ought to be doing? I believe what we're going to find, and what's been found in earlier big county studies of this kind, is that actually doing the right thing winds up saving money, not costing money, but also doing the right thing for police officers, for people in emergency rooms, for providing the kinds of connections and alternatives needed make a big difference. And for all of the healthcare providers and the law enforcement individuals involved, I'm grateful for what they do, and I think we're seeing some real results from the bill that this body passed, the President Obama signed, now in law, and producing great results. And with that, Mr. President, I will yield the floor.